Alright, as your heart increases, your heart rate increases to maintain adequate cardiac output, it's stimulated by epinephrine and our beta 1, our beta 1 receptor site, so that our heart rate can increase. There are other things that help the heart to increase on its own. The heart has a special type of cell that allows it to conduct electricity and allows this automaticity to occur. So that's where we can have a resting heart rate of about 60. But when we need to increase that based on our workload or exercise or exertion, this heart rate can go up to maintain our blood volume as we increase the workload or demand on our body. Therefore, as we look at the heart and automaticity, we should review a little bit on the electrical conduction system and how this all comes into play. This is a skeleton-like drawing of the electrical conduction system. We have the initial pacemaker site called the SA node. It's the original pacemaker site. This should be firing all the time unless there's some type of injury, trauma, toxin that negates or causes the SA node to give up. The electrical impulse from this generator stimulates impulses that travel throughout the upper chambers of the heart, both on the right and left side. These upper chambers are called the atria. As a result, this wiring here, as the signal continues through this pathway, we call this intra-atrial pathway. There's a transient slowing at our AV node. To allow the emptying of the atria so that the ventricles can then expand slightly more. And so when they contract, the ventricles contract. They have like larger or slightly extra kick of blood volume. This allows that Starling principle where you have Frank Starling principle where that extra stretch allows for a more vigorous and robust contraction of the ventricle. So we have slight pausing for the electrical conduction system here at the AV node, and then it comes down through the bundle of His. This is where all of these ventricular wires bundle together. As it goes down through this bundle of His, it then conducts the electrical signal throughout these ventricular fibers, and they travel down the right and left bundle branches. Right and left bundle branches. This wire is very important as this electrical impulse travels down through that connection to allow the ventricles to contract. And as they contract, they then eject the blood volume out. One going into the lungs and the other side going out to the system. As this signal continues throughout the bundle branches, it then gets conducted through further into the ventricle system called the Purkinje fibers. Purkinje fibers.